This video will cover the skeletal system. In it, I will expect you to learn bone, osteoclast, osteoblast, skeleton, axial and appendicular skeleton, osteoporosis, and fracture. Be able to define and find the bones that are listed in bold in this presentation. This is not every bone in the body. Be able to differentiate between axial and appendicular bones. Be able to identify and differentiate between the bones of the skull. Be able to identify the bones of the pectoral and pelvic girdles, be able to compare the pectoral and pelvic girdles, and identify common traumatic injuries to the skeleton. Bones are connective tissue. Let's talk about the structure of bones before moving into identifying all of the bones. Bones are made of cells in a dense extracellular matrix of calcium phosphate and proteins. This makes them connective tissue because they are cells in a matrix. We also have chondrocytes, which are made of cartilage. That's shown here. Those grow slowly and do not have a blood supply. But the cells known as osteocytes that we find in the bone have a blood supply and do grow relatively quickly compared to chondrocytes. I invite you to refer to your book to look at more information about osteocytes and how they grow, but we will not be covering it specifically in this lecture. One role is found in the marrow, and this depends on what type of marrow the bone has. Yellow bone marrow is fat used for energy. If you have ever cooked bones and seen that fatty stuff in the middle, that's yellow bone marrow. And that is a way of storing fat in the body. Red bone marrow contains stem cells that will produce blood cells. If you have ever heard of someone who has leukemia, you know they need a bone marrow transplant. That is red bone marrow. Leukemia is also a cancer that is growing in these. And what that means is that bone cells can become cancerous and bone marrow can become cancerous. And since there is a blood supply to the bones, cancers elsewhere can become malignant and can actually spread into the bones, into the marrow. We also see here on this bone the epiphysis, diaphysis, and another epiphysis. While we are not going to be defining these terms, it is wise to look at this. The diaphysis is this long part of a long bone, and the epiphysis is the end. There are two ends to this long bone. We also look at bones in terms of things attached to them, such as ligaments, and things between them, such as cartilage. These are both types of connective tissue, but are not themselves part of bone tissue. Ligaments connect bones to muscles and connect bones to one another. Ligaments are slow growing, and therefore ligaments are slow to heal. It is a bad thing if these get torn. Dense fibrous connective tissue makes up ligaments. Please refer to the tissues lecture if you do not know what dense fibrous connective tissue is. Cartilage is found at the ends of bones because bones do not rub against each other. Well, if things are going well, bones do not rub against each other. And cartilage serves as support under pressure. You may want to refer back to the tissues lecture to look at the different types of cartilage found between bones. It is also notable that bones develop from a cartilage framework and a cartilage structure. And bones grow as the individual grows. In fact, babies have a skeleton that is partially made of bone and partially made of cartilage because bone is going to be developing from cartilage. So you start with a cartilage framework and certain cells differentiate to become osteocytes, bone cells. And these osteocytes will lay down bone. Now, if you have ever had sore bones as they are growing, that is because the diaphysis is growing, that long part of a long bone, and that is growing along something known as the epiphyseal plate, labeled here in the adolescent as the cartilage growth plate. That is where growth occurs. Bones are constantly remodeled. They are a dynamic system. So if there was an uneven stress being applied to a bone, say by walking persistently with a limp, you will have compressive force applied unevenly. And this bone has a history of compressive force being applied unevenly. As you see, it has bent. It has bent over time because it has remodeled itself. Let's say that stance is corrected and now the individual no longer limps, but now applies compressive force directly above. What will happen is osteoclasts will remove bone from the side that is not under pressure. and osteoblasts will build bone on the side that is under pressure. Think of osteoclasts. They break down bone. Clast means breaking. So iconoclast is someone who breaks icons. Osteoblasts, you see that B for building. They build bones. Osteoblasts and osteoclasts are constantly acting in the body to subtly reshape the bones. In a weightlifter, you're going to actually have thicker bones because they are being put under more pressure, and the osteoblasts are more active building bones so that the bones don't fracture under the pressure of a heavy bench press. Exercise strengthens the bones. A lack of exercise will mean that the osteoclasts will simply take out bone where it is not needed. So someone who is sedentary for long periods of time will actually have less dense bones due to the action of osteoclasts dissolving bones. Let's look at this skeleton. It's beautiful. It is made of long, short, flat, and irregular bones. There are 206 bones in the human body. We will not be memorizing all of them today. It is notable that males and females have the same bones. Males do not have one less rib than females. The axial skeleton. This is shown here. Skull, spinal column, ribs. So let's look at the skull. I would like you to know the bones in bold for this skull. The mandible or lower jawbone will hold teeth and is used in chewing. The maxilla or upper jawbone makes up a sizable portion of the face and holds teeth used for chewing. The frontal bone is located on the forehead and is directly above the frontal lobe of the brain. The temporal bone is located on the side of the head and is located directly above the temporal lobe. The parietal bone is located on the top and towards the back of the head and is located above the parietal lobe of the brain. The occipital bone is located in the back of the head and is located directly above the occipital lobe of the brain. These are useful bones to remember because you also will be learning the lobes of the brain. I would also like you to take a moment and look at the foramen magnum. This is where the spinal cord will interact with the brain. It's not a bone, rather it is a hole in the skull. This is important for human physiology because that hole is located on the bottom of the skull. Think for a moment where the spinal cord attaches to the brain and consider where it would be located in something like a dog or a cat. There are injuries that can occur to the skull bones. Blunt force trauma to the head from falls, blows to the head, an auto accident, or sports involving large balls, such as if you try to take a header to a bowling ball. These can be open or closed depending on whether or not bones are sticking out of the skin. The bump that comes from these will often take some time to form, as there is not a lot of circulation up there and it takes a while for swelling to occur. A concussion is not an injury to the skull bones per se, but is an injury to the brain that occurs when too much force is applied to the head. The hyoid bone is a special bone for a special job. This is something of interest, although not specifically part of the axial skeleton. It's not really part of the appendicular either for where we're covering it, so we're just looking at it separately here. It's attached to the larynx and tongue, and very specially, it's not attached to other bones. It has a role in speech, helping move the muscles around the larynx, and also has a role in swallowing. Interestingly, it's made of 3 different parts that do not always fuse in all individuals, meaning you may have a hyoid bone that is in actually several different parts. It is also important for forensics, broken during strangulation. It's a delicate bone, and it can be broken, but it also can occur in different segments depending on how well they fuse together. Knowing this is essential if you're going into forensics and looking at possible cases of strangulation. The vertebral column. This is made of cervical vertebrae, which are found in the neck, thoracic vertebrae, which attach to the thorax and the ribs, lumbar vertebrae located below the ribs but above the pelvis, the sacrum, which is 5 fused bones, and the coccyx or tailbones, which are 4 bones that are fused. Take a moment and consider different types of injury that may occur to each. What type of injury would occur if you tried to lift something by bending your body forward and then pulling it directly up. Where would you hurt yourself on the vertebral column? The ribs. There are 12 pairs, as mentioned earlier, in both males and females. There are, at the bottom here, floating ribs that are not attached to the sternum, and there is, in the center here, the sternum, which attaches the non-floating ribs. Cartilage is what attaches the ribs to the sternum, allowing a certain amount of flexion. This is good because ribs need to move when you're breathing in or breathing out. Ribs are relatively compressible as well, and this cartilage helps in them being relatively compressible. And those are the parts of the axial skeleton. Moving on to the appendicular skeleton, which is basically everything else, mainly the limbs. First off, the pectoral girdle and the arm. The scapula or shoulder blade is in the back. The clavicle, you can tap that. That is your collarbone. There are 2 of them, and they're attached in the middle here. There is a humerus for each arm, which is the bone of the upper arm and is pretty strong. The radius and ulna make up the forearm. If you have your thumbs facing out from your body, the radius is facing out from your body, and the ulna is interior to your body. There are then the carpals, metacarpals, and phalanges that make up the wrist, hand, and fingers. In the pelvic girdle, you have the coxal bones and sacrum, which are all fused together to make something called the pelvis. You could compare these to your scapula and clavicle in the pectoral girdle, except in the pelvic girdle, these are fused together. The femur is very similar to the humerus of the arm, but is much thicker and longer. There is also a patella, the kneecap. The kneecap is absent from the pectoral girdle because there is no such thing as an elbow cap. So this is a special extra bone found in the leg. The tibia and fibula are similar to the radius and ulna. But while the radius and ulna will rotate around each other as you rotate your hand, the tibia and fibula do not rotate around each other because your foot is less movable. There are then, of course, the tarsals, metatarsals, and phalanges of the ankle, foot, and toe bones. One is specialized and a bit longer, making up a heel bone. So these are several differences between the pelvic girdle and leg versus the pectoral girdle and arm. Pelvis width varies. And while we are trained generally that there is a male pelvis width and a female pelvis width, like all good things in biology, it's far more complicated than that. There are actually 4 main pelvis types, and they can be found in both male and female. There is a gradient between female and male. There is not simply one width fits all of one sex. Nope, there's actually different types. There are gynecoid, platypeloid, android, and anthropoid. As you may guess, some are more common in males, some are more common in females. Both are found in both. And to make matters even more fun, the pelvis width varies within individuals based on their ages. That's right. Even within an individual, the width of the pelvis changes. It is not, as we are often taught, one simple width for all that are a single biological sex. This is something important to know for those going into gynecology or for those who just don't want to make a fool of themselves by saying there are only 2 pelvises. Let's talk about some disorders and problems of the skeletal system. First off, osteoporosis. More calcium is often needed for the bones than is found in a diet poor in calcium. What this means is that osteoclasts are going to take calcium out of the bones if more calcium is needed in the body but is not being taken in with a diet. So if osteoclast activity surpasses osteoblast activity, this will cause brittleness of bones. Remember, osteoclasts dissolve bones and break things down. Osteoblasts build up bones, and these are both active constantly. So this will also happen when there is a sedentary lifestyle. This will increase the risk of osteoporosis. Why? Please refer to earlier. A bit of advice, increase the calcium in your diet after age 35 because less calcium is being absorbed at that point and your body just needs more calcium. This will help stave off osteoporosis, increasing calcium and having an active lifestyle with plentiful exercise. Let's talk about common traumatic injuries and compare them with accidents. These are what is often seen from abuse. There will be rib injuries in infants. This is not a common injury from accidents. Injuries to the scapula, spine, and sternum are not common in infants or young kids and can be indicators of someone being picked up and squeezed or shaken. 80% of fractures due to abuse occur in children 18 months or younger. One reason that this is unlikely to be an accident is children 18 months and younger are not very mobile, which means femoral and humeral fractures, think about those two big bones in the pectoral and pelvic girdle, in kids not yet walking are very uncommon. You also want to look at concurrent injuries such as bruising or other things that have occurred. And if one sees injuries in different states of healing at the first visit to an emergency room, this is an indicator that some injuries may not have been reported, and one must ask why. Of course, kids are very prone to accidents as well. It is common to have accidents in the radius and ulna breaking, like my brother, who would break them every year. Accidents that occur in the wrist are common, especially among kids who are biking, skateboarding, or base jumping. This will happen when the individual tries to stop themselves with the hand. The tibia and fibula are often broken as well, especially if individuals are hitting these against large objects or falling. And things to the ankle, well, that's very common, especially if you're tripping. Auto accidents will cause injuries to the ribs. Injuries and broken bones in the pelvis are going to be common in older individuals with osteoporosis as these bones weaken and as they form a core part of the body. As they get weaker, these can be injured very easily. So fractures. Well, bones have three roles. They have to be lightweight enough that we can still move around. They have to be strong enough that we don't break them all the time. And they have to be flexible enough to take a certain level of abuse. Having all three of these things means trade-offs must be made and fractures will occur. The different types of fractures are not going to be memorized for this class, but may be helpful for you later on. Open fractures are when the bone is going to be piercing out of the body. Closed fractures stay in the body. Displaced means the bone has gone somewhere it's not supposed to be. They're also not displaced where the bone is remaining exactly where it should be. A green stick fracture has a break on one side, but merely strain, stress, or bend on the other. Comminuted means there are parts of the bone in between the two broken ends of the bone. Transverse is perpendicular to the long axis of the bone. Impacted is when the bone has been broken and then firmly driven into each other. And stress fractures are often just being very sore at a specific part of the bone and can be hairline fractures as well, very common in sports. How do bones get repaired? Well, this depends on a closed or open fracture, whether or not clotting is going to be needed and whether other tissues will need to be repaired as well, or whether bones will have to be put back together, as you see with this comminuted fracture right here. Bones repair faster when the individual is young and healthy. Bones repair much slower when the individual is not healthy or when the individual is old. First aid and long-term recovery are key, but the bones are capable of repairing themselves for the most part. And bone is replaced not with scar tissue, but with other bone tissue, starting with a cartilage framework and then building up different parts of the bone. So that bone replaces bone, and then bone is remodeled to the stresses it's undergoing by the osteoclasts and osteoblasts. Bone is a living and dynamic system that is capable of self-repair and contains many different functions for the human body.